Hello and welcome to PsychTalk. Today I'll be interviewing two very important men in psychology, B.F. Skinner and Carl Rogers. B.F. Skinner has made operant conditioning super popular with his rat and pigeon experiment, and Carl Rogers has taken on a totally different approach to psychology, a positive one. So let's begin our discussion and see what they have to say today. Hi, how are you?
Good, how are you?
Nice to meet you.
It's really nice to meet you.
It's really nice to meet you. So, let's start off our discussion with some questions for both of you. Please describe your approach to psychology.
Well, I'll go first if that's okay with you.
Of course, go right ahead.
I'm a behaviorist, so I believe that our behaviors can be manipulated through conditioning. If you don't like a certain behavior, you can be taught to behave a different way. And if you want a certain behavior, you can make it happen.
All right, sounds really interesting. Sounds like you people are easily manipulated and changed. Do you agree with this, Rogers?
No, not at all. I believe, and us humanists also, that all people are born good and our motives are always positive, and that our behavior cannot be controlled or manipulated at all. And people are influenced by their desire to be good, and people shouldn't try to change how people are.
Oh wow, those are some different views. So, tell me, how do you treat your patients?
Actually, I prefer to call them clients because patient sounds very negative.
Well, I call them patients. And when it comes to treating them, we try to focus more on changing behaviors instead of thoughts and feelings. We use things such as systematic desensitization.
Oh, please tell me more about that.
Well, it's the gradual exposure of anxiety or fear to the patient to try to get them to overcome it. We also use aversive conditioning, which is pairing up a negative thought with their fear to try to get them to stop thinking that way.
Oh, so like alcoholics and smokers, making their addiction unpleasant so they stop doing it.
Right.
Wow, what a great idea. That could be really useful. So, how do you treat your patients, Rogers? Clients.
Well, my approach to treating my clients is very personal. It's very client-based therapy, and we help them to find themselves, and we both strive to find a common goal. And yeah.
So the goal is to find themselves?
Yes, one's ideal self is who they wish to be, and we try to get them to that state. It's very client-centered.
So, Rogers, do you agree with Skinner's methods to treating anxiety?
Honestly, no. It's way too forceful and focused on changing who they are. Instead, I'd use active listening.
Oh, because active listening would work.
Yes, it would. Thank you very much.
Unbelievable.
Active listening is when you listen and reflect on what someone has to say so that they can elaborate more on it and you can get insight.
So, what I'm getting is that, Rogers, you want to treat people by helping them realize their own problems and solving them, and Skinner, you think you can change their behavior to solve their problems.
That's the gist of it, yeah.
Yeah.
All right, those are some pretty opposing views. So let's take a caller question. Sarah has agoraphobia. For those of you at home that don't know what agoraphobia is, it is a fear of public places. How would you guys treat Sarah?
Well, I would probably throw her in the mall, a crowded open place that she's probably terrified of.
It's pretty, yeah.
Yeah, I call it flooding because you put the patient in the most extreme, fearful situation they can imagine. They have to overcome it.
Interesting.
Right.
What about you, Rogers?
Well, I would look at their personal goals and overcoming the fear and why it's important to them so that they can use their personal determination, and then we would discuss how you can overcome the fear together.
Those are some great ideas from both of you. So, Skinner, why don't you tell me more about your rat and pigeon experiment?
Okay, well, through the process of operant conditioning, rats and pigeons were placed in a Skinner box, and they were conditioned to turn or press a button in order to get food out of it.
So food is used as reinforcement?
Yeah, when they performed the correct behavior, they were given the food as a reinforcer.
That might work with animals, but a human cannot be compared to a pigeon.
Well, some principles do apply. I mean, humans are motivated by incentives, just like the animals were motivated by incentives in the Skinner box.
Do you think motivation comes from somewhere else?
Yes, it's internal. Motivation comes from a person's desire to do and be good.
But what about murderers and psychopaths? They definitely don't want to be
Yeah,
good.
Carl.
Well, they did once. Unfortunately, it wasn't a cheat, so they just stopped trying.
What do you think about that, Skinner?
Well, I think all their negative behaviors could be fixed with some operant conditioning.
That easy, huh? Someone should try that. Well, let's take another audience question. This one's for Rogers. What is your greatest accomplishment?
That would probably coming up with unconditional positive regard.
What's that?
It's, even if you make a mistake, it's just viewed as a bad choice or decision. The person itself is not considered a bad person.
Aw, that's really sweet. Do you agree with that, Skinner?
I mean, it's okay. I mean, that was kind of okay, but not as cool as token economies. I mean, that's really cool.
Token economies, what's that?
It's when desirable behaviors are reinforced with valuable objects or points that can be turned in for something else.
Oh wow, that would work really great with little kids.
Yeah, little kids or anyone else, really.
How true. Well, that's all we have time for today. Let's finish with one last question. What is the best method to approaching psychology?
Humanist.
Wow. Anyways, that's about all we have time for today, folks. This is Nina reporting for PsychTalk, and I'll be seeing you next week when I interview Sigmund Freud. Tune in!